My name is David Aronstein, and I'm the director of the CHNA 19, the Boston Alliance for Community Health. Welcome. You are doing just what the intention of this is to connect with your peers, and that's why we call it a gathering, not a conference. I wanted to just briefly go over the agenda. Our timing will get adjusted based on our late start, but we'll get through everything. We'll do some introductions, and then Amanda Winters from the Massachusetts Council on Compulsive Gambling is going to talk to us for a little while, and we're particularly happy that and grateful that the council has paid for our lunch. So we're very pleased about that. Then we have Andrea Freeman, who is from the Massachusetts Public Health Association, who is going to lead us in a discussion about advocacy, particularly around ballot questions, and, what's allowed, what's not, and what they are. And then we'll have a bit of a discussion about the new determination of need regulations and what that process is. Nobody from the Department of Public Health is here to represent the Department of Public Health, so I'm going to attempt to give you my understanding of it, and I'll be the messenger, just the messenger. We'll have lunch. And then after lunch, Lew Finfer, who some of you may know, he's a longtime community organizer in Boston. He'll be here from the Massachusetts Communities Action Network to talk to us about, particularly about an initiative they have called Jobs Not Jails Coalition, and some process that's going on in the state to really move some interesting legislation forward. So, we will kind of adjust as necessary. With that, welcome. So, as you see, a lot of really good work, and all health related, but actually very few diseases mentioned, which is, we're not in the sick care business, we're in the health business. Try to connect with people if you want to talk more about what they're working on. And let me now turn it over to Amanda.
Good morning. I'd like to thank Wendy for so kindly inviting me to speak this morning. I am Amanda Winters. I am the Assistant Director of Programs and Services at Mass Council on Compulsive Gambling. So I don't want to lock the panel, please. So I'd like to just begin by telling you a little bit about my organization. The Massachusetts Council on Compulsive Gambling is a nonprofit organization. It was started in 1983. Originally, our services were just to provide a helpline to those who felt that they were having a problem with their gambling or had loved ones who were having problems with their gambling. You can switch the slide. So we've been around for almost 34 years. And why do we exist still? Well, we still operate the 24-hour helpline. You can call in any hour of the day, and somebody from the council will answer during the working hours, and we'll have a service answer after that, and we'll provide services. We can refer you to treatment. We can provide tools and resources about compulsive gambling and how to help family members. We also provide trainings, clinical development. We want to promote awareness. We have a certificate. MAPGS stands for the Massachusetts Problem Gambling Specialist Certificate. And we use those individuals in the community to refer to. So if somebody calls in with a problem, we will refer them to treatment that way. We also provide technical assistance and advocacy on the state level. We want to promote public awareness. So before we jump into more stuff, I want to give you some basic definitions. Oh, skip that one. So gambling is defined as risking something of value on an outcome of an event when the probability of winning is less than certain. This doesn't come from the dictionary, and it doesn't come from Gamblers Anonymous. We picked this one, it comes from a study. We found that it really encompassed best what gambling is and what it means. So what is problem gambling? Problem gambling is when you can't control it. Just like when people have addiction or mental health problems, it's not a choice that someone makes. We know that the DSM-5 states problem gambling as the only non-substance addictive disorder. So that means there's no substance, but people are still addicted to the behavior. So in Massachusetts, we know that from a Sigma study that was recently done, we know that 3 in 5 people report that they know somebody who plays too much. And almost 75% of Massachusetts residents have gambled in the last year. If I asked you how much do you think the average resident spends a year on gambling, can somebody give me an answer? $50 a year.
$136.
$136. This is like the Price is Right. Massachusetts resident spends about $200 on lottery products a year. In Massachusetts, the average person spends $888 a year. That's almost $3 a day on lottery tickets. Yeah. So that's quite a bit.
Is Mass like on the top?
We are. Oh,
States, like
yeah.
the #1 gambling
Are we at the top?
We are. We're actually second in the world.
Ooh,
Only to Macau. I am not kidding.
Who's first in the world?
Macau. Yeah, so we have. It's a country in Southeast Asia.
And the whole country is based on casinos, Macau.
Yes.
Yeah,
Pretty much.
so that's pretty sad.
So that leads into the idea that there's probably a problem. If everybody in here had such a low number of how much they think people are spending, that means somebody else is making up for that and spending more. And that means that person might have a problem, right? So we know that 1.7 or 2% of the adult population has a problem with gambling. That doesn't seem like a lot, does it? No. That's about 5 million people in the United States and 100,011 people. So if I said, do you know somebody who has naturally occurring red hair? How many people know somebody that has naturally occurring red hair? Right? Okay. So 2% of the population has naturally occurring red hair. There's a really good likelihood that you know somebody who has a problem with gambling. But it's not something that you can see, just like it's not something you can see, it's not something you can smell in somebody. You can't tell if somebody's high on problem gambling. You don't know. It's a very hidden addiction. In addition to the 2% of people that we know have a problem, there's another 7.5% of people who are at risk for developing a problem. So how do we know where these people are? Well, we have risk factors we can identify. We also have this fancy map of Massachusetts, and we have the ability to look up lottery data and to do just this and map it out. We can see how many vendors are at each place, and then by taking the census data, we can do the math and see how many people over the age of 18 are there and how much they're spending on average in lottery. So some of these we know, like in Salisbury, that's a very close border state. Many people come across the border to participate in the Massachusetts lottery because it has such a high revenue and such successful games. But when we look at some places like East Boston and down here around South Massachusetts, we know that we should probably be focusing our concentration there on working with some of the programs that my council offers. So, here again is more graphs of that we can see exactly how much the U.S. average, as I said before, about $200 Massachusetts, and then it just goes down.
So these aren't, that wasn't residents, that was like the Salisbury one is all of New Hampshire coming into Salisbury?
I don't think
Okay.
so. Some of New Hampshire coming into Salisbury, people
Right.
taking that Route 1
Right.
corridor, but
Right.
not
Yeah.
all of it.
Okay.
Yeah, that's gonna skew that number, but the one in West Bridgewater won't be skewed that way.
Right.
Right.
You gonna go back up?
You want to go back over
back
it?
to that.
Yeah, just for I have a bunch of these printed out over here, these little facts, so you can take them home, you can use them as you please.
So we don't know the average age of the person applying after 18? No, I know about over 18, but
The average age, no, because they don't collect any kind of demographic information when you're
I know
purchasing.
the organization had gone around and done a study at all, because I was just curious, I see a lot of elderly buying.
How many people do you know buy lottery tickets for Christmas presents and give them to children that are under 18? stocking stuffers? I've heard of that a million times.
So we talked a little bit about the DSM-5 already.
Is that a code that doctors use?
That is a code. You know, the DSM-5 is the Diagnostic and
Yes.
Statistical Manual, and so this is the code
So
for it.
I wrote down that question, can a doctor write that code and get treatment based on writing down that code?
Yes, they
Okay,
can.
Okay, that's what was.
And that's where we train the MAPGS and probably the counselors
Okay,
to recognize, and then they can bill for it.
okay, that's good.
Next couple of slides are blank.
Oh, good.
Um,
Just scroll through those.
Okay.
So in addition to geographically identifying what are risk factors, we know that some personality traits and there are some other risk factors. You keep pressing the button. It'll pop up.
Fly in.
Yeah. I'll make the sound. So when we talk about risk factors, we know that being a child of a compulsive gambler, believing that there's skill involved in it, an early big win, chasing your losses, feeling that you need to gamble more to get back what you've lost, starting to gamble early, large first bets, or other addictions. So comorbidity is high. 90% of people who are diagnosed with a compulsive gambling disorder also have another co-occurring disorder. So we look at other mental health issues, we look at other addiction disorders. So 75% of those people have a substance abuse disorder.
What about mental health disorder?
Yes, that's also great.
Bipolar.
About 68% of people have a mood disorder that are associated with it, or to have personality disorder. I have more fact sheets with all that information really fleshed out.
It's all subsumed under the major disorder, mental illness.
Right.
But we treat it separately and disperse our power.
Well, so when we talk about ways to treat it, I think that when we look at the public health model, we know one of the most effective things to do is prevention, is to prevent compulsive gambling, is to take that 7.5% who are at risk for developing it and move them down the scale so they're no longer at high risk for developing it. So we want to empower individuals or groups to create healthier lifestyles, to create better attitudes.
Can you just clarify, the numbers and averages, is that just for lottery tickets, or is that for all gambling?
That's for lottery tickets.
So
So
we can track, because that's trackable.
Right.
Right,
Okay,
well, that's
I got
trackable, and also, we only have one slots parlor right now, and it's only been here for a year, but the STIGMA study, the social and economic impacts of gambling in Massachusetts, which is done by UMass Amherst, looks at all that throughout the entire state, and they do research in Plainridge, the casino that's been developed, and so we have very little information that we've been able to extrapolate yet, but
That
we're
makes
working
sense,
on
yeah.
it. We're
And
working
we
on
don't
it.
have information on Massachusetts residents that are traveling to Foxwoods
Right,
or
right,
either
Right,
side.
right.
So
And
that's
well,
another
Or
piece of
online
it.
gambling.
Right, right.
The ones that we
Yeah.
can state.
Because this field's only been around for about 20 years, and since the Expanded Gaming Act in 2011, we've only really ramped up our efforts in terms of best practice, so data collection, looking at programs that are effective, and monitoring and benchmarking our successes in the field of compulsive gambling. So when we talk about prevention and how we're trying to do this, we look at the three different areas, micro, macro, meso. So we want to talk to the individual, we want to talk to communities, and then we want to change policies. Like for example, when Wendy brought up scratch tickets, we look at workplaces. A good example of a meso practice would be a policy, implementing a no gambling policy, because it's not just something that would affect the individual, being given a scratch ticket. It also affects those who are at the job site, being asked by the gambler, can I have $5? Do you have $5? That's imposing on that person too, and that makes everybody feel uncomfortable. So what we try to do is find solutions for these problems. How can we help you implement something in your community, in your life, or in your organization that would promote safety and reduce the harms from gambling? So what else? Well, this is where I'm going to talk about myself for a little bit. So I know you're all wondering, what do I do every day besides come here and talk to people? I wear two hats right now. I work at the Massachusetts Council on Compulsive Gambling, and I do prevention, and I work with the programs there. But I also work with GameSense. So GameSense is in the 2011 Expanded Gaming Act, it was required that a treatment site and an education center be put into all the facilities. So what we did is we put in GameSense. GameSense is a model from British Columbia, and it works to provide player education on slots, on odds, randomness, hit frequency, everything that's associated with problem gambling. It also helps people to voluntarily self-exclude. So if you decide I no longer want to be allowed in the casino, you can go to the GameSense Information Center and sign up, and you will no longer be allowed in the casino. If you do get in and you win, your winnings will be taken by the state. So we have GameSense is the first of its kind in this country. And we've just recently launched another new tool, which is Play My Way. So when we look at some of the strategies for prevention, we know that pre-commitment is a really big benefit that we can use. Like think about when you go to the grocery store. If you pre-committed to spending only $100 and you had a tool to monitor that, you'd probably stay on track. When we first launched Play My Way, that's how I explained it to everybody because it was confusing. So what they have for Play My Way is a frequent flyer card at the casino, marquee rewards card, they slide it in, and they set a daily, weekly, or monthly budget. And then are alerted at 25, 50, and 75% when they reach that budget. Never stops them from playing, just gives you the option to see where you are. And you can check your balance anytime to see how much you've spent above, under, or close to your budget. I wish I had that at the grocery store because I would not buy Oreos every week if I knew it was going to be that much over. So this is all part of our responsible gaming program. Right? We want people to play responsibly. That whole 90% of people who can manage and who can do it, that's great. And we want to help them and we want to empower them to continue to make good choices. Now let me put that hat over here and take back my Mass Council hat. And we'll talk about the different tools that we have in the organization and we want to promote with your communities and help you to use. So community involvement, right? That's really where change begins. Like I love, Marcia, talking about that walking school bus. That's amazing. And that's a great example of community involvement and getting everybody who is a stakeholder to the table to learn. And so some of the tools we use for community involvement are with youth. So we have the creative actions for probability and statistics, CAPS. We teach kids math because we know if we start teaching kids early, they'll have a better understanding. When we look at learning, it's fluid, right? The more you do something, the more you're able to apply it everywhere. Think about like if you learned German in a classroom and then you went to Germany, it would be a lot different. It would be really hard to see and to work with it. But if you learn math and you're able to apply math to not just your daily life, but also to some other skills that were transitions, like gambling, other life choices, you're less likely to engage in risky behavior. We also have the community assistance programs. So we find faith-based communities or other community organizations who have natural helpers in them, and we train them how to identify and recognize signs of mental illness, problem gambling, addiction, and how they can intervene and help, where to refer people when they do find an individual, a family member, or something that's wrong.
What kind of tools are those?
Pardon me?
What specifically types of tools do they use?
It's training, so we train them on recognizing signs, on how to intervene, how to not in a non-clinical approach, so a community-based approach.
So is it like a certain best practice that we could look at and see what, like when you, or just you have your curriculum that you use?
We have a curriculum, and I can absolutely share it with you.
Yeah, no, I'd just be interested because it seems like it could be applicable to signs for other issues other than gambling.
It is, and that's exactly what we try to do because gambling isn't like a fun topic. Nobody really wants to talk about it, and so trying to find ways to pair it with other disorders or other programs is the best practice we've found. So like I said before, when we see people who are suffering from compulsive gambling, 90% of them have another problem. And so while it might not present first as problem gambling, it might present as something else, or vice versa. Training across the spectrum is really the best way.
Yeah, I think just engaging clergy, as you were saying, you know, it'd be interesting to see what kind of tools are really effective with, because they are a huge, I mean, from my perspective, like an untapped resource.
Absolutely.
And if we can have there be an effective tool with them, then that would be interesting just to share.
Thank you. So we have the CAPS, and then we have a new initiative we're working up in Lawrence with the Lawrence Stream Network to train beauticians and barbers on how to provide basic assessments and referrals and weaving it into their conversation. We've seen this as a really effective model in other areas, so I think it's Bobby or Billy's Barbershop in Methuen has a recovery center in the back of the barbershop. I know, so it's really great. We also work with the corrections field to provide training to correctional officers and providers. But really what the base is we want to provide education and we want to make it easy and palatable for everybody to understand. So I have a variety of these kind of fun little facts and sheets in the back, and we've really been working to try to make it so that everybody can understand. Like I said before, it's fluid. You want to be able to apply it to different things. So I'm going to read you some did you knows. Did you know? I think this is Wendy's favorite. You're more likely to date a millionaire than to win $5 on a $2 scratch ticket. Did you know you're more likely, it's more likely that a person believes aliens have infiltrated Earth disguised as humans than it is for them to win $3 on Lucky for Life? It's more likely to believe Elvis is still alive than to win $2 on a $1 scratch ticket. You're more likely to meet your significant other on a blind date than to win $2 in the Mega Millions. It's more likely to get a hole-in-one than to win $150 on a $5 scratch ticket. You're more likely to have a genius child than to win $20 on a $1 scratch ticket. You're more likely to be mistakenly declared dead due to Social Security data error than to win $500 in the Mega Millions. You're more likely to receive a new identity under the Witness Protection Program than to win $200 on a $2 scratch ticket. Here's a tiny one. You're more likely to become president than to win $7,000 in a week. $7,000 a week than Lucky for Life. I like this one. It's more likely to have identical quadruplets than to win $1,000 in the McDonald's Monopoly game. Right? So just providing education, things of that nature that make it fun, make it lighthearted. Because gambling can be a really serious topic, and it's not something we often talk about, but it's important.
I'm going to say a comment there. They just had somebody just the other night, because the lottery brings in a ton of money, right? I mean, a lot of money, and it goes back to the cities and towns. So there's maybe not an incentive to have that cut down, but for most of us know, people who buy the lottery tickets are probably the less should be buying the lottery tickets, at least can afford. Okay, but they'll always put things out. They just put something out the other night, and I thought, a guy won a second $1 million lottery ticket.
I saw that.
Right, and you go, well, what's the chance of that happening? And the minute thing that I say, he must be playing a lottery a lot. Okay?
Right.
And I know this, for instance, because my husband's a CPA, and he sees a lot of things, and we always have this discussion about people that win the lottery play a lot. And they may give half of their earnings back. Because even if they win $1 million, you thought, if I win $1 million, I ain't playing anymore. I'm good, right? No, but the problem is they do keep playing. So that only addresses the lottery piece, not even the gambling piece, which is a whole nother thing.
Well, the lottery is considered gambling.
Right.
Because you're risking something on a
Right,
chance
but I
of
mean like the
success.
casino piece. But
Oh,
anybody
yeah.
who goes to a store, a convenience store, I mean, near us, they're like set up like lotto. There's people sitting in there all day playing lottery.
Mm-hmm.
Not sure whether they're working, and I do see a lot of older folks, which is a big issue.
Yeah.
Because they might not have money for food, but they have money for lottery, so.
I think it's important when we talk about all kinds of addiction,
Yep.
that we don't make distinctions that some people could be addicted to that and it's okay, and some people shouldn't be addicted to that because they don't have money to play. So I think that we have to sort of look at that all people are in the same position, and that we shouldn't be passing the judgment that, oh, you make enough money, so it's okay for you to buy a
No,
lottery
it's
ticket,
okay.
but you don't make enough money.
I work too hard for my money.
So you shouldn't. So I think it's very important whenever we talk about addiction that we talk about the entire population, all spectrums of the population, all socioeconomic groups, and don't just focus our tasks on people that perhaps we think shouldn't be doing.
But are there data that shows that people with less income spend more on gambling?
That is correct, yes.
And I think that's like.
It's understanding the odds, the chances of not winning.
Right.
Yet they promote every day how much people are winning. So you can see it's a full, like, you know,
And that's one of the unique things with disordered gambling and problem gambling that we look at, because no other addiction is glamorized
Right.
and promoted, such as gambling can be. We don't see.
You can have cancer game show, like we have You Could Be a Millionaire game show.
Right, yeah.
But we
right.
don't have You Can Get Cancer game show.
Right, right. Like even when they have the big lotteries, you're incented to pay into them, and you know it's really a fool's game, right? The chance of winning is very difficult.
Mike,
It's true.
telling you to do it?
Yeah. So what else do we have? Well, we have screening tools, and problem identification screening tools, and identifying the problem. Where is it? How do you see it? And how do you get help? So I have these fancy little fact sheets over there for you guys so you can look. We try to make it as friendly as possible, as I said before, and as easy for people to understand and less stigmatized, because that's one thing we find with all addictions, but especially with problem gambling, because it's so new and it's not seen so frequently. People think you could just stop going to, just stop buying lottery tickets. But imagine if you were addicted to a substance like cocaine and you had to carry around a little baggie with you all day. How hard would that be? That's how sometimes problem gamblers feel with money, because it's part of our everyday life. So understanding that piece of it and looking deeper in the community, as Wendy had said before, it's not always it's a problem because you don't have the money. Ben Affleck has a lot more money than I do to gamble with, but maybe Ben Affleck doesn't have the time to spend gambling, and that's where the problem is coming up, because it doesn't just affect our finances, it affects our social life, our work, our family. We can see the ramifications. So here's some of the programs that I spoke about before that we have and that we can offer to your communities to come and provide technical assistance to help you set up and have conversations in your CHNAs with your organizations. We have youth, the CAPS, Teens Know Your Limits, Real Life 101, which is a financial literacy piece. We have CAP, the Community Assistance Program or Congregational Assistance Program. This year we'll be piloting 2 Gatekeeper Train the Trainers with RAs and college students from across the state. We have programs for older adults. Talk about money, talk about alternative activities. You don't have to go to the casino. You don't have to go to bingo. There's plenty of other things you can do. We have tools for CHNAs, for example, environmental scans, walking around. We have a checklist, walking around seeing how many vendors are there on the street that have lottery tickets. How many of them are advertising? What types of advertisements are they doing? Because it's impactful on everybody, not just adults. We did a photo voice in Somerville recently where the youth went out and took pictures after we had done some trainings and talked about gambling, and they identified a lot of different things in the community. I gave very loose guidelines, and they came back with really interesting stuff, you know, pictures of power lines, because they said people are helpless against their addiction, pictures of lottery tickets on the floor, you know, a bike so that people could start their path to recovery. It was really interesting to see how the youth perceive what we as adults don't always take the time to look at. So the next slides, I think, are just resources, and I'm happy to provide you with all of the numbers, the helpline number, and anything you might have, but I'd like to open up to just a few questions if we have any questions.
What are we doing to prevent the providers of gambling?
Prevent them?
Yeah, keep casinos out, stop the lottery. It's like, I mean, you can compare it to nicotine addiction.
Right. So all of the lottery vendors are provided with education on responsible gaming, because gambling is not harmful to everybody. 90% of the population is able to gamble with 0 to no consequences. So providing education to the lottery vendors, to the casino staff. Instead, we're in the casino 20 hours a day. We're there to provide education not only to the patrons, but also to the staff at Plain Ridge Park Casino. And we'll continue to do that as new casinos are developed and built in Massachusetts.
It looks like you're taking a bone from the bad guys by saying, oh, here, we'll give you X amount of dollars.
Well, they're
to
not
promote
bad. We take a
education.
neutral stance on gambling, so it's neither good nor bad, and we're friends with the people there because they're not out to harm. They're a business operation that most people are able to successfully enjoy, but they recognize as well as we do that some people have problems, and so we all seek together to work to create a less harmful product and to aid those who do have problems with it.
Okay.
And I can see that point of view, because it's, I mean, you're not gonna shut down every liquor store because they're alcoholics. You're not gonna shut down every restaurant because some people are addicted to food. I mean, it's the person, the onus is really on the person with the problem to seek help.
So promoting individuals to empower themselves to make the choice. That's what we seek to do, is to provide people with information on odds and statistics, financial literacy, and responsible gambling strategies. How can you manage your time? Are you making sure you're setting a limit? Are you setting a budget?
If you compare alcoholism and the vulnerability of certain populations, it's genetic. And we need to be alerting kids education-wise about their vulnerability to become an alcoholic. And gambling is just providing me that the comparison, because I don't see that as, it is an addiction.
Right.
And it appeals to some vulnerability in one's makeup. And it isn't exclusively genetic. Like a food addiction has to do with our genetic metabolism.
But that's a larger argument of, I think, environment or genetics. And so we can talk about that. Absolutely, some people are predisposed to have those problems, but we are seeking to inform youth in the most sensitive way we can, as to not say, here's gambling, you should do it, as to say more like, here's some pieces of financial literacy, here's some information on the lottery, what are your thoughts on it, and how can you help us to inform community members? So we are inspiring youth to speak with community leaders in their community. So maybe it's a T-ball coach. Does the T-ball league have a policy for parents about gambling? Is there something that's promoting that within the schools? Are youth feeling empowered to speak to their parents about it? Because we know parents are the biggest influence on youth and how they act and what they end up doing.
Time for one or two more questions.
Was it your group that was on PR on Tuesday?
I believe yes.
So it's sort of interesting because it does speak a little bit to what this woman was saying. I mean, I was listening to it in the background, so I didn't catch the whole story. So I'm not really sure what the underlying argument was for. They were basically talking to a casino developer who was trying to open a casino in Revere, if I'm correct. And there was some argument to the casino. It was not only just, we're a neutral I mean, they seemed to have a position. It was interesting.
I've heard that NPR story yet. But generally, we seek to help the communities to what is going to maximize the benefit there.
Well, for instance, WIN is coming into Everett, and they're very happy about that. But yet in the community, there is definitely some concerns about, chronic gambling and providing a place, so what's that going to do? I believe WIN had to put in a bunch of money to kind of combat that issue. So to the issue of maybe you can't, like you said, only 7% of the people have a problem, what is considered a problem, could be higher, I think probably. But you can't not have it because it is entertainment, or, my father goes to casino all the time. He doesn't have a problem with it. He spends a little money. He probably has that card issue. He spends $50 and comes back. So for him, it's entertainment. But you can see it being for other folks a problem. But I think with the WIN situation, they had to put a lot of money up front to kind of help with community programs. I don't know what it was, but it was big dollars, what I heard.
The Xfinity Gaming Act does require into a public health trust fund that money goes so that it can mitigate and help with community support with addiction, mental health, and other services to ensure that it isn't a problem. We can look at research that suggests both communities that have casinos have successfully profited and have not, and so it's a mixed bag, but I'm just here to provide education and information for individuals and communities so they can make their own informed decisions.
Yes. Well, thank you very much.
Thank you. Thank you.
Annette,